Welcome to Smart PT. My name is Jonathan Reimer. This week we're talking about dorsal lunate. So the lunate, as you know, is in the center and top row of the carpal bones, articulating with the radius. It is wedge-shaped with the wider side on the dorsal aspect. It's designed that way. It's a bit of a design flaw because it makes it prone to this particular problem, but the reason for it is if it was designed to slide in a palmar direction, you would get a lot of impingement issues with the median nerve. So it's designed this way with a bit of a flaw in terms of its stability, but in order to protect the median nerve. So what happens with the dorsal lunate, if it pops dorsally, often with a fouche injury, a fall on the outstretched hand, it doesn't seem to matter in my experience whether people land this way or this way on the hand. The lunate tends to pop dorsally with either type of fall. Now, when the lunate shifts dorsally, it blocks extension of the wrist, because as we extend our wrist, the lunate needs to be able to glide in a palmar direction. So if it's fixated or stuck in a dorsal position, as the person tries to extend the wrist, the lunate can't clear and it becomes a kind of a bony impingement of the lunate against the radius. This particularly is most notable to the clients when they try to load the wrist, as when doing a push-up or pushing up out of their chair, or in yoga, for example, people are doing a lot of loaded wrist positions. So that tends to become the main aggravating factor. So what you're typically going to see on examination is when they flex the wrist, you'll often see a prominence of the lunate. There'll be normal flexion generally, but when you go to extend the wrist, they might have pain, that sense of pinching returning, and you'll typically feel a harder end feel to overpressure because the lunate is stuck and not able to glide in that palmar direction. So what you want to do to correct the dorsal lunate is you want to overlap our fingers of our index and middle finger on the radius, and I'm going to overlap my thumbs on the lunate. It's a flick type technique, but what's important to not do is to overextend the wrist, because that'll start to bring the wrist into closed pack position and you won't get a good adjustment. I like to lean my body backwards a little bit to create a little traction, and then a lift and a flick downwards. So I'll just demonstrate that for you. Okay, so it's not a big extension of the wrist, it's just a quick flick, and the abrupt stop at the end tends to force the lunate that's displaced into the palmar direction. What we need to do following that is very important as well, because it's going to be a somewhat unstable joint after you reduce it from its fixated position. So typically what I will do is 2 or 3 strips of white athletic tape around the wrist, and I want them to use that anytime they're going to be loading or twisting through the wrist. They don't need to use it if they're going to be reading a book or typing on a computer, but if they're going to be putting any load or stress through the wrist in the gym, they need to have that protected, and they need to do that for a minimum of 4 and ideally 6 weeks. Yes, you'll get some skin irritation of the hair, but you really need to have that stabilized. Otherwise, you'll be right back to square one. Okay, so that's the follow-up. There's not really great exercises for this particular problem. You're welcome to do resisted isometrics and things of that nature, but we know that there's no small stabilizing muscles. That's why it's so important to protect with an external stabilizer of the tape. All right, thank you. Check us out on Facebook or on smartpt.ca.